Well, we face the same sort of challenges I think that hospitals have. I think the biggest thing I've gained from the summit is that, we really have the same goal in mind, and that's to move the patient efficiently and smoothly throughout the transition of care. I think oftentimes the acute care world and post-acute care world don't speak enough about that flow. We realize that we oftentimes become a bottleneck for the hospitals. And so, we face those same challenges, moving the patient at the appropriate time and as efficiently and as, with as low of cost as possible for the patient. We've really focused on our strategic relationships with our hospital providers, viewing them as partners in the market that I'm in. We've worked very hard to develop those relationships with our hospitals to better understand the acute care world side and what challenges they have. And then we've tried to tailor our processes and our systems to meet those needs. We work in skilled nursing facilities and home care, and so obviously we know that when a patient's ready to discharge out of one of those, the quickest that we can possibly either make that bed or that nursing agent at a home care agent available for a patient, the better for the patient, which is ultimately what it's all about. So we've really focused on our strategic alliances and our relationships with providers. Well, we've obviously seen an impact to our census, no doubt about it. So on the financial side of things, just like a hospital, we're looking for a healthy census. And things are changing in the post-acute care world. Whereas we were, for so many years, seen as long-term care, we have fewer and fewer long-term care patients. That's primarily in relation to the way that pay sources have changed. Medicare, Medicaid, all the managed care companies into our side of the industry as well. And so we've really had to focus more on bed turnover than we ever have before, and understanding that. So by understanding that that's a factor for us now, really shifting some of our processes to focus on bed turnover, smooth transitions, smooth discharge planning from the time, inheriting the discharge plan from the acute care world, following that plan throughout our world and getting a patient back to the community has really impacted our census in a positive way. But bottom line, customer satisfaction too. The majority of it's driven by the changes in healthcare, and it's really the push from the top to get patients in and out quicker, to get them better quicker, to get them back to the community quicker, and to do it all at a lower cost. We recognize that's forced a lot of changes on our end. And quite honestly, with the changes in insurances, with the rise of the managed care as a pay source now, we see a different population come to us. Whereas, 10 or 15 years ago, you're really looking at what you would define as senior care, people who are coming to spend the last few years of their lives with us. That trend's really changed. We're seeing a lot younger people come to us for elective surgery because the post-acute care world has proved that we can enhance that care. We can get them better and back to the community faster when they come through our rehab, our therapy and our rehab, and really transition home smoother. So that's changed things drastically for us, logistically, environmentally, with the services that we provide, with the services that are expected of us, having a younger population now. And so that's all driven by the healthcare reform, I think.